We find ourselves in an all-out war trying to fend off territorial bugs, thirsty mosquitoes, and more. So waking up with bumps, lumps, blisters, and other injuries is a common summertime occurrence. Here to tell us what bit me and how to treat it is Dr. Kenneth Perry, an emergency physician with Trident Medical Center. Thanks for being here.
No problem. Thanks for having me.
Thank you so much for being here. Okay, so I'm finding myself outdoors a little bit more now,
Right.
and so just simply walking on the grass, I come back and my legs are all chewed up. So I'm sure I'm not the first person to tell you this.
Not at all. Not at all. At least we're not in the emergency department when it happens, right? So, it's certainly something this time of the year. We love living in the low country for the ability to get outside, but being outside really puts us at risk of being in contact with these bugs, mites, and other insects.
Yeah, so let's talk about some of the most common ones. Let's just start with the mosquito, because that's something that we
Sure.
talk a lot about here.
Absolutely. So mosquito bites are easy sort of in the morning or in the evening. You're really at high risk for them. And the bite themselves is itchy and it's annoying, but it's really concerning because mosquitoes actually can carry some really bad infections that can cause you long-term problems.
Now, if they feast on prey that they have some sort of blood disease, can that get passed on? And I'm not just talking malaria.
Right. There is an ability for a mosquito to transmit diseases. Because of the way that they bite, they actually, there's a little bit, it's really gross, but a little bit of their saliva goes into your skin.
Right.
It's why you don't feel the mosquito biting you. It actually numbs the area a little bit, and it makes the blood a little bit thinner, so it can actually suck a little bit easier. So in that sense, it certainly can put you at risk of them.
So besides malaria, what other diseases most commonly?
So you certainly know you're going to have triple E, or which is Eastern equine encephalitis, or some other really horrible things that we talk about more in sort of a as they happen sort of cycle. A lot of encephalitis, a lot of brain issues.
Goodness, and not to scare everybody, but I mean just to make you aware, and then we'll talk about repellents in a little bit. Now you said that the mosquito, you don't really feel the sting, and it's true, but the deer fly or horse fly, now that is something that you feel.
I hear that you might have had
Yes.
some personal experience.
And they're so aggressive too. I've never seen one before, and it was pretty scary.
They are, and you know, they certainly do come right at you. They can certainly bite, and their bite is extremely painful. But luckily, they don't have the same ability to transmit diseases per se. So you know, it's more a localized response, and it's that pain that occurs at the time that's the worst.
Okay, so the flies that we have here in the South or domestic United States, it's not the tsetse fly, which is far more dangerous.
Absolutely.
Well, that's good to hear. Okay, let's talk about fire ants now, because those are the bane of my existence.
As they are for a lot of homeowners in the low country.
And the bite, painful, very painful, but then the aftermath, me personally, I tend to swell a lot, but people can actually suffer anaphylactic shock.
Absolutely.
Ooh.
So fire ant bites, of course, they have that localized response. They end up looking sort of like small pimples after a while, but the bite themselves can be really pro-allergy for a lot of people. So they can end up having a localized response to their limb, as you were describing, but it can also cause nausea, vomiting, difficulty breathing, to the point where they actually might need an EpiPen after they're getting bitten.
Oh, good, and that's a severe allergy. Let's work backwards. Now, I was bitten recently by something that gave me a big blister, and it made my legs swell a bit, and it was hot to the touch and very sore. What do you think that was?
It's really difficult to know exactly what it was, but you actually bring up a really good point. It doesn't matter what bit you as much as the fact that you really have to know how to take care of it after it happens. Clean the area really well. Infection can happen no matter what bit you. Spiders get a lot of bad credibility for their ability to cause these large areas of redness and swelling, but we don't know if they're really spider bites all the time.
Right.
Either way, clean the area. Make sure that you're seeing a doctor if you ever think that it's infected and need antibiotics.
And we have all kinds of spiders here as well. The brown recluse, which are quite dangerous, black widows. So just the best way to fend them off is to wear protective clothing and just be careful where you're stepping.
Absolutely, especially if you know that you have lots of dark areas with lots of wood stored. Certainly don't want to just put an unexposed hand into it. You don't want to know. You don't know what's there.
Sure. Let's quickly talk about ticks, because those can be dangerous for both your pets and for yourself.
Absolutely. You know, we know about Lyme disease or Rocky Mountain spotted fever. It's certainly something that is important. Ticks, the biggest thing with ticks is you want to make sure that they don't stay on you for more than any amount of time, right? We know right now that Lyme disease and some of these other ones, it's about a 3-day window, where if it's embedded for 3 days, you puts you at much higher risk. So as soon as you go outside, make sure you check everybody in your family, hairline, areas where you wouldn't normally think, and the tick might be there.
Yes, good point. Let's talk about some repellents now. So we want to keep them at bay, so not just the tall boots and the protective clothing,
Right.
but what about some repellents that are good?
It's difficult. Sometimes we have to balance the fact that there are some chemicals in some of these repellents, but they work really well. So we have to know whether or not it's important to keep the tick off you or to keep the insect off you, or if you want to use things like DEET. So a DEET-based product really does keep a lot of the insects away. You just have to know that after you wear it, you have to make sure you shower. You don't want that on your skin for a really long time.
Certainly don't. And just real quick, we're already over our
Yeah.
time, but I want to ask you, what's the best way to treat it?
Basically, make sure you keep the area clean and dry, and if you have any concern with difficulty breathing or concern with the allergic reaction, you can certainly come to the emergency department or to your primary care doctor.
Thank you so much, Doctor.
No problem.
Appreciate
Thank
that.
you.
We're back after this.